Dr. Rick Bright, it is such an honor to be with you and to have shared this experience of the Ridenhour Awards, the 19th Annual Ridenhour Awards, which I always bring tissues to. It is so inspiring, and I look forward to it all year. And I'm particularly honored to be with you. You won the Ridenhour Award for Truth-Telling in 2020. And unfortunately, we were not live back then. We were all sitting on screens. And so it's really special to be in 3D with you today. And I just want to, I have to, mention the supporters of the Ridenhour Awards, which are, it's presented by the Fertel Foundation, Stuart Mott Foundation, Project on Government Oversight, Type Media Center, and Government Accountability Project. And they're the ones who bring these heroes together every year. So you were the director of BARDA, and I'm only going to say it once, the Biomedical Advanced Research and Development Authority under HHS, so that I can now just say BARDA. And tell me a little bit about, what's going through your mind. This is even before it's declared a pandemic. It's your role to make sure that public is prepared for, this thing that hadn't existed before, called a pandemic. And so what are you seeing? Just take us back to that time in early 2020.
Well, Roberta, before we do, I have to just say, you mentioned the emotional feeling from the ceremony we just witnessed, the 19th Annual Ridenhour Awards. And I didn't expect it to be so emotional. As you said, I didn't get to be here. We didn't have a ceremony in 2020 because of the pandemic. And being here in person and seeing and hearing the stories of people who have spoken up and spoken this truth to power and had the courage that they've had, is very emotional, it's very empowering, it's very moving. And for me, having gone through what I went through at the start of this pandemic personally, I even think, as someone who made that decision to speak up, and we'll talk about that, and go through the onslaught of the aftermath of telling the truth, I still think we try to hide that in ourselves somewhere, and going through and seeing this again today just sort of rips those emotions back out of that safe spot.
It's a little
within
PTSD.
The person. It really is. Yeah. It really is. And to me, I'm so happy to see these courageous people and do the things they do. At the same time, I'm so sad that we still have to go through this in our society, and it's so painful to tell the truth, and what we heard today, how isolating and lonely it is. And so I just really am so proud of the people we celebrated today, and the community I felt in the room and through the dialogues with the Ridenhour organization, because it is a group that really puts this courage and this truth-telling first and forefront, and we need to continue celebrating those heroes for their courage.
Of which you are one. And it's a pretty special group, and it gives me great hope every year to hear those stories, as well as inspiration that there are these people out there who are protecting the public and standing up for truth. So take us back.
So I'll go back into now.
Take us, if I know, but
2019.
Let's go.
Let's go 2019. Well, I've worked in pandemic preparedness my entire professional life. So for now about 30 years, since the first spillover of an avian influenza virus in 1997 in Hong Kong from birds to humans, we realized acutely the threat that we all face as a human race and population if we have a virus or even a bacteria or even some fungi that were to spill over from animals to people and spread rapidly when we had no drugs or no vaccines or no way to protect ourselves. We're very vulnerable to it. We've never seen it as a human species before. And the consequences of that, be it an intentional attack from someone, a nefarious organization or state organization, or from an accident in a lab, or from nature, which is happening more and more frequently. So I decided at that point in my career that I would spend my career studying viruses and how they change, how they affect people, and the things that we need to do to detect those things early and put everything in place to be able to stop it and contain it before it becomes a disastrous outcome.
And
like
did you believe that it was something that would happen on your watch?
I knew the risk was really high, really, really high. So I was working in this field in 2009 when we had this influenza H1N1 pandemic. And we hadn't had a major pandemic since 1968 was the previous influenza outbreak that was a pandemic. And 57 before that, and then 1918 was what we really saw as a devastating pandemic for influenza. So I lived through that 2009 experience, and I saw the dishevelment of government. And I saw the isolationism in people around the world who were in Africa, in parts of Southeast Asia, Middle America even, who were last in line to get the vaccines and drugs that we made in the wealthier parts of the world. And so in that moment is when I joined BARDA, the organization you described, with an intent to make sure that we had the vaccines and the drugs and the diagnostics and the masks, that what we call personal protective equipment or PPE. And not only that we had them available to us in the United States, but I led an international program to build vaccine manufacturing capacity around the world in low and middle income countries, because we knew that an outbreak anywhere would be devastating to all of us everywhere. And so going through that experience and then dedicating my career in BARDA to work with the public and the private sector and international organizations to make sure, to come hell or high water, when that moment came, that we would know it and we would know what to do, we would know what was needed, and we would act, and the world would not have to suffer.
And when did you know, I mean, were you worried in 2019, or was it in early 2020 that you were, oh my God, this is a happening thing?
Well, because of my role in government, I had access to information that wasn't yet publicly available. And so it really was in the 2019 when government officials knew that there was a pneumonia of unknown origin that was infecting people and spreading to people in China. And it really wasn't until early January of 2020 when we started really seeing the news. We saw China in Wuhan building a hospital, an entire hospital in 3 or 4 days. We saw the nurses and doctors shaving their heads and all the hair on their body and sleeping in the hospital because they're afraid of this unknown virus. And they didn't want to take it home. They didn't want to infect their family. They saw incalculable deaths already. So we knew at that moment, anyone who understands viruses, who understands terrorism, who understands public health,
and
that
travel.
There was a crisis at the border, at hand. And at that moment, we should have been doing everything possible to line up every resource we had and enacting the pandemic response plan that our government and many other governments had in place on the shelf, ready to go.
And you're directing that effort, and when did you start to feel and see and hear the pushback?
Well, my anxiety was rising, as I think it was for many virologists around the world who understood these viruses and how rapidly they could spread. In early January, probably the first or second week of January, and as we got more and more reports of this virus spreading to neighboring countries, I mean, it was just so
obvious?
Clear. No one would have a doubt. And I pushed forward a memo, an email, to our Assistant Secretary for Preparedness and Response. Let the title sink in. Who reports directly to our Secretary of Health and Human Services, who reports directly to the President of the United States, that we have an issue and we haven't even held the first meeting of what we called our disaster leadership group for an emergency response meeting to take an assessment of what was happening so we can begin responding to that. And so I pushed that memo forward and said, we need to have a meeting. We need to bring the CDC and the FDA and the NIH and all of HHS together, and Department of Defense and all relevant departments, Homeland Security, together in this planned meeting to discuss the situation and put our action plans in place.
And what was the response?
The response was, why bother? I don't see this sense of urgency. There doesn't seem to be an emergency here. Why are you acting this way?
Was there concern about scaring the public?
I think there is a lot of denialism. I think at the highest levels of our government, in the White House, there was pressure to downplay the situation. There was pressure to deny the truth of what was really happening. And part of that was probably to try to appear not to be vulnerable, a vulnerable nation. Part of it would probably be to not scare the general population. But what happened in an effort, if it was to not scare the general population, is we didn't give the general population the information needed to take appropriate action to save their life. We didn't tell the truth about this virus and the risk that we faced as people. We didn't tell the truth about the simple measures that we could take to protect ourselves from it, including wearing a mask and keeping some social distance. None of that stuff came through. And I went into meetings with the Secretary of Health and Human Services and leadership representing each of the agencies, the CDC, the FDA, the NIH, and BARDA, and ASPR, and others. And I said, we have an emergency on our hands. We need money, we need people, and we need information about this virus.
And the public needs information.
And the public needs to know what's happening. And Roberta, I was kicked out of those meetings. I was not invited back. I was called a tyrant and a nuisance among the people in that meeting just for raising to attention in a very closed setting that we needed to act. Because that was counter to the message that the White House wanted to go out at that time.
And what would, I assume talking to colleagues, I mean, did you reach out to Dr. Fauci, for instance? Did you have a conversation with him?
Dr. Fauci and his staff was part of these meetings. And so we had representatives there. Dr. Fauci was supportive that we needed to begin gearing up our resources. We needed to begin studying the virus. We needed to start the work on vaccines and drugs and diagnostics. He was part of those meetings. So it wasn't total disagreement in that group, but it was the leadership of that group leading up to the White House that decided we weren't going to take action. We were going to let this virus continue to spread out of control. We weren't going to put testing in place. We were going to deny its existence, and if we didn't test, we didn't see it, then it must not exist. And then once we did start any type of reaction, it was so racist. It was such a push against Chinese citizens and Chinese national people. If you were Chinese, then you were the enemy. If you came from China, you could be a Caucasian American or maybe a Caucasian Chinese citizen as well. But if you look like a Caucasian, then you weren't scrutinized, you weren't tested, you surely aren't carrying the virus with you. But if you were Chinese and you were quarantined and tested and sent back home. And so that sort of ignorance and that sort of discrimination at the time only put Americans in the world at more risk.
Well, the former president insisted on calling it the China virus.
Which is disgusting, which is what led to the millions of deaths we have in the United States and the millions of people who have died around the world, because the United States was looked upon as a world leader in public health, a world leader in, we've invested so much in pandemic preparedness, we knew the plans, we had the playbook. And for the President of the United States to make this a nationalistic attack, a racist attack, and to use this disaster to push an agenda was what lowered and stripped the United States of that credibility. It stripped us of the leadership opportunity. At the same time, remember, the President of the United States also pulled us out of and decided to stop supporting the World Health Organization.
I forgot about that, yes.
So it wasn't just the discrimination and the anti-China agenda that they had at the time. It was also stripping us out of and reducing the funds to the organizations that we all relied on to get us through such a disaster. So as if not only making us vulnerable and lying, but just cutting us off at the knees, tying our hands behind our back, as if to welcome the disaster and the calamity, economic and life and societal, that followed.
So you have all this experience, you're a virologist, you're directing BARDA. What happened to you? You're shut out of the meetings of all of the different agencies at HHS. What's going through your mind?
Well, I continued to work with our scientists in BARDA and our collaborations we had across the Department of Health and Human Services with the CDC and NIH and FDA, Department of Defense and others. We marched to the beat of our own drummer. We knew what was happening, so we still pushed forward relationships and contracts with companies that could respond and make masks, that could respond and make diagnostics and start work on the vaccines and drugs. We continued to do that hard work. If it wasn't for those civil servants that worked day and night and are still working day and night, and the public-private partnerships, the scientists in the companies too, working closely with BARDA and HHS, we wouldn't have the drugs and vaccines, so we wouldn't have had them on time. So I just kept pushing onward. And at the time, making the progress, but then the president decided to tout this drug, chloroquine and hydroxychloroquine. This came out of the blue. This was completely broadsided me and every other scientist we had in our interagency organization. Coming from a meeting in the White House that would determine that this was the drug, these companies were going to play a critical role, the president was going to support this, and I had 24 hours or 48 hours at the time to put in place a process to push this unproven, contaminated drug, never inspected by the FDA, coming in from Pakistan and India, et cetera, and put a system in place to push it out into the streets and into the hands of every American to start popping these pills so they wouldn't get this, wouldn't get infected with this virus.
Those are your marching orders.
Those are the marching orders.
From
and
the
that was
president.
the timeline from the White House. And from the White House task force, which included the president and many agencies and many politicals in the White House, all the way through the Secretary of Health and Human Services, through the leadership of the Assistant Secretary for Preparedness Response, from DOD, from FEMA, who was in charge of part of the emergency response. The memos, the emails that came through that says flood the streets with this drug.
Unproven drug too.
An unproven drug. An uninspected drug. Honestly, this drug was flown into our country in the dark of night. I had those memos. Fly it in, hide it here, do a photo op there, and then get it into the pharmacies so we can push it out. And I was given a timeline to do that, but that timeline was based on when the President of the United States was going to make a public announcement that he had the solution and push this drug. And I had to make sure by the time he said that, this drug was flowing.
And so at this point, what are you thinking in terms of, how you can stop it, how you can make sense of, it's kind of madness.
The pressure was enormous. The pressure from every political operative working in the administration at that time. And
the pressure to get it out there?
To get it out there, to do this.
Yeah.
And we were in uncharted territory. This was becoming that breaking point. And I was feeling that pressure. I relied heavily on the scientists that we have in the government. And I tell you, government scientists are in the United States especially, some of the best in the world. And they're not getting paid much. They're doing this because they believe in this. They're public service. Mm-hmm. And they're doing it because of their oath to Americans, their oath to our Constitution, to protect people and save lives in the face of any disaster. And I relied on them to study all the science we had, which was limited, and their recommendations came back repeatedly. This week, we should not do this. So our teams worked with the NIH and the FDA to put in place an emergency use authorization. And this is a regulatory instrument, and we can put parameters in this regulatory instrument on when and how an unproven or unapproved drug could or should be used. And I thought it was quite clever that these experts, especially the colleagues at the FDA, could put in the bumpers, the boundaries, that we can consider this drug, mm-hmm. and it can be used, but only in the context of a controlled clinical study, a randomized controlled clinical study, only in the context of people who are in the hospital under the supervision of a physician. Mm-hmm. That's what you do with an unproven drug. You don't push it out in the streets like Tylenol.
And oh, by the way, you turned out all of those scientists were right. It was not the solution.
It wasn't the solution. In fact, it killed people.
Right.
In fact, it was a dangerous drug. And it was very shortly after we signed that emergency use authorization, it was actually within 2 days, that the administration said, I'll be damned about an EUA, or emergency use authorization, push it out anyway. That's when I broke my silence. When I saw the public health officials that we had elected and had been appointed disregard science completely, railroad over all of it to push a dangerous drug out, regardless of the best work that we'd put in to ensure the safety and to be able to monitor and evaluate that drug. And that is when I had to face the challenge of revealing these actions. And I made that decision to share this information with the media. And I mean, and honestly, the media, there are several representatives, several reporters who were tracking everything we're doing and constantly calling me. And I, never talked to any of them before this. But I figured I had to do something because the risk to Americans was already high, and it was about to get magnitudes higher if we'd push this drug out.
So what kind of soul searching was involved? I mean, this is all under, we're talking life and death, an emergency situation. Who did you talk to, and what, how was your family, warning you don't do it, or saying go for it, or how are your colleagues? I mean, who did you talk to before going to the media, which is a very brave, courageous thing to do, but it is also potentially career-ending?
Roberta, I didn't talk to anyone. I think truth tellers and people who break the ice and go forward, it's very rare they have an opportunity to talk to someone. And I didn't tell anyone I did that. It was a decision I felt was really right in sharing that information. And I did it very secretively at first, very anonymously at first. No one knew where this information came from when the story broke in Reuters. Mm-hmm. And then the pressure only intensified internally. And then it was just a few weeks after that, after I'd received some threats from my superiors in that they had suspected it was me. And therefore, they were making a decision to reassign me, to move me out of access to the information and the things they were doing, because didn't want me speaking to
Sharing
anyone.
it with the public.
Telling the truth. And so they made that decision then to retaliate and demote me and push me into a silent corner of the NIH, and they were going to railroad this response over Americans. And that is when I was able to talk to my partner, and we called a lawyer, and we called a firm, and this is Deborah Katz.
Right, who handles whistleblowers.
Who handles whistleblowers.
Yeah.
And she got on the line, and she listened to the story, and she said, we have to do something, but the choice is yours. The choice is yours to stay silent or to share the information anonymously or to put your name on it, your face on it, and go forward. And she said it will be tough. And so then my partner, and we're married now, so my husband, we took a walk. We took a walk around the park in our neighborhood, and we discussed the risk. It's very emotional. It's very emotional. But we discussed the consequences too of, what would happen to our life if I did say something, but what would happen to the lives of so many people in our country and around the world if I didn't?
Right.
And how much more impact it would be, because everyone that tried to speak forward and tell the truth in this last administration was slaughtered. And so you can be an anonymous person and do so, but if you go forward and put your name on it, you're putting your life at risk.
Right, but you're also adding credibility to the truth-telling in terms of that you know what you're talking about. You're, a globally well-respected scientist. And
we decided together that I would put my name out there and go forward and be the highest ranking official in the Trump administration to come out to tell the truth.
Blow the whistle.
To blow the whistle. And we did. I mean, the help, thank God we had the team at Katz, Marshall and Banks now. It's Katz, Bank and Cuban now. But thank God we had that team, because they held on to me every single day. And every day was a roller coaster. I got death threats immediately. So many people around the world, though, stood up and said they were so happy, so proud, thank you. And so many came at me with knives and guns and threats, and through a newspaper published our address in the paper, in the New York Times. And so therefore our house was being circled and things thrown at it constantly. We had armed security guards outside 24/7. And it was just 3 days into it, we had to make the decision to disappear. 3 days into this onslaught
that must
for
have
telling
been
the truth.
Terrifying.
Absolutely terrifying.
Yeah, I mean, these are people saying what to you?
Oh, and honestly, the media was trying to dig up whatever they could, dirt. They called my family in Kansas. They intimidated my family in Kansas. They tried to see everything I've done my entire life. They tried to discredit me in so many ways. And the Trump administration was fueling that work. And there were people from the administration calling and intimidating my family, who is a very quiet little family in middle of Kansas. And they don't really understand what I do in Washington, D.C., or what I've done in science. And this is cruel. But we marched onward, and it was so important to get the story together, to tell the truth. And very wise Congresswoman I talked to, she gave me some good advice, and that was to not litigate my case or the story in the public. Choose an outlet, one outlet, and tell your story for the world to hear, and then to testify, go before Congress, and tell that story, because the world needs to hear it. And to walk proudly, for doing the right thing. And it was when we were in isolation, when we were in hiding from the death threats. It's when you really search your soul. And when so many stories were out there trying to accuse me of doing this or doing that, you really second guess yourself. And you feel very isolated. You feel very lonely. It's the same story we heard today from the whistleblowers and the truth tellers on this, at the ceremony today. And so many people that reached out to me who are whistleblowers, who aren't in the public domain still. So many anonymous whistleblowers reached out to me to say thank you and to ask me for advice and guidance on how to secure themselves, their family, and tell their story.
Did you have any sense, Dr. Bright, about what you were, sort of jumping into the abyss, and what was your expectation of what would happen next, or did you think that your colleagues would stand up for you also, would support you? What were your thoughts?
That's a really good question. First of all, the main reason I did this was not for any attention or limelight or anything. The main reason I did this was to alert Americans in the world of this risk and to educate Americans on what they can do to save their life, to tell Americans that they were being lied to from the White House and from the administration, and their lives were at risk, and we needed to do everything we could possible. I did this to try to save lives. That is what I'd learned, that's what I trained to, that was the oath I'd taken, and that was where my moral compass lies.
Where did cronyism come in terms of what the push was from the White House?
So much corruption was taking place.
Say more about that.
So many contracts were being put in place without scientific evidence. So many calls were coming from the White House or from different parts of Congress, from billionaires, from influencers, saying they had a cure, they had a solution, they had a silver bullet, they had the magic touch. And
drink some bleach.
Drink bleach or magical light, or use chloroquine or hydroxychloroquine, use ivermectin. Or these stories were all tied to individual and organization trying to make money, trying to profit off the situation, damned to be American lives and the lives of people around the world.
So where was the potential money being made in terms
of
the
government contracts? And my job as director of BARDA was to be that gatekeeper, to make sure that where American dollars, the taxpayer dollars, were invested, it was invested wisely. And I relied on the expert panel from civil servants across our government to be able to review that information, look at those data, and give the recommendation on
peer-reviewed science?
Peer review, scientific peer review from experts, not from politicians, not from wealth makers, not from lobbying groups. Because the wolves were at the door. And we were looking at thousands of new ideas almost every week, and so hundreds a day. So there is a lot of stuff flowing. The money, it sounds like a lot of money for a pandemic response, but it really wasn't enough, still isn't enough to control this. So we had to be very judicious. And we also had to make sure that we were doing our best to protect Americans from these miracle cures that could kill them, could make them worse, and even make them believe they were protected when they weren't, when they were vulnerable still. Watching the flood of counterfeit personal protective equipment come in, watching our government refuse to turn on the resources to scale up N95 mask production in our country so our nurses and doctors could have high quality PPE to protect their lives, so they're on that front line fighting and protecting patients. And
you're just seeing a shortage, and what are you seeing in terms of the nurses and the doctors who are unprotected?
Our nurses and doctors were getting imported stuff that is like masks. You may as well punched holes in it. They were so ineffective, and that's what our government was putting out for our nurses and doctors. We saw our nurses and doctors putting trash bags on themselves. Never ever forget those images of our healthcare workers doing everything possible because their government had failed them, because we did not ramp up PPE production in time, even though I was in the White House in January and February screaming at people who I believed could make a difference and influence that White House task force to unleash the resources that we needed to ramp up production of masks and gloves and gowns, to scale up production of vials that we needed, and swabs for diagnostic tests. All of these things, we knew there was a shortage. It was no secret there was a shortage. Everyone that could do anything about it knew there was a dire shortage. And the only conversations we had in those disaster response group meetings wasn't about, well, how do I ramp this up as quickly as possible? It was about, how do I change the guidelines? How do I lie to Americans and tell them it's not so bad so they don't panic and go out and hoard these limited materials? That was where the energy was spent, on how to lie instead of how to tell the truth, that we're at risk, and then how to do something about it. Now, you asked me about my colleagues in government, and when I came forward, my expectation was that they would raise their hands and help. And more people would come forward to say, yes, that's happening, yes, that's happening, we need to do more in this. And I honestly felt a little betrayed and isolated, and it made me feel even more isolated and lonely in that moment, because more people weren't coming forward and confirming what I was saying. Although a lot of them were doing it anonymously or behind the scenes, I learned much later.
But because they were afraid of losing their jobs, or what?
They were afraid of their life. They were afraid of losing their jobs. They were afraid of their family being put at risk. There were threats to not talk to me. There were threats to not speak up. And they intensified when I spoke up.
Those people were right in terms of what happened to you with death threats. And
they were right, and they had families to worry about. They had to put food on the table. And I have come to understand those actions. And I do appreciate them. And it's sad that we are still in this world where it takes so much for someone with courage to break the ice and come forward. And then it takes so much more for those people to follow still. Because we do think when someone comes forward, well, we're just going to have this
they're seeing what's
floodgate of
happening
support.
to you, and they're intimidated. And that's part of the
me.
program, I guess, is
It's
intimidating.
intimidation. But they would write to me, and they said, I would really love to say something. I would really love to speak up. I'd really love to help you in some way, but I can't. And my feelings and emotions about that were, I was really hurt. But now I understand. I do understand. And now many of them have spoken up. Many of them have given information to some of the committees investigating the response. Some of them have and continue to do so anonymously, because it's still not a safe environment. We can't just change the administration and think you change the climate.
It's a
for
bureaucracy.
Telling the truth. It's still dangerous.
Do you have a perspective, Dr. Bright, about what the difference would be in terms of lives lost had they followed the scientific protocol instead of the magic?
We lost so much footing by delaying, by lying, by mixing the messages to people who very clearly would have followed our messaging about protecting themselves, wearing a mask, social distancing, getting tested. Millions of people around the world are dead because the United States failed to be honest. In our country, I think over 300,000 people are in the ground today because they didn't trust the vaccine. Even when we had the vaccine, it was so politicized by President Trump and his administration. They politicized and weaponized that life-saving tool, and so many people were afraid to take it and didn't trust it. They didn't trust their government. They didn't trust science. The way they politicized science and the way they denigrated scientists and attacked scientists.
Attacked the truth.
And attacked the truth. And so people didn't get vaccinated. People still aren't vaccinated today because they don't know, they don't understand the truth about the vaccine. And I was hoping, and many of my colleagues were hoping, that we could continue our public narrative and communication to try to convince more and more people about the safety of this vaccine. It wasn't an overnight miracle. The vaccine is a technology, the mRNA-based vaccines are technology that BARDA invested in for many years before, the government and Department of Defense invested in for a decade before. There was a decade of work behind these, a lot of knowledge about safety and about their reaction and about how valuable they can be in protecting you from that virus. And the message never got out to the public in a clear way.
Well, the legacy is really, of that administration, is alternative facts.
They pride themselves on that, and that was where they invested. You know, they invested a lot of money, millions of dollars, to rewrite science. And they overruled and rewrote the scientific guidance coming from the Center for Disease Control. And they invested millions of dollars in public relations firms to hide the truth or tell a different version of the truth, designed to confuse the public, designed to incite that fear and divide our society in yet another way than they were doing to divide our society, to instill hate, because from that hate and divisiveness is where they were drawing power and drawing their authoritarianism. And we are still suffering the consequences today, not just in the pandemic and people who want to politicize mask wearing still, people who still don't want to take the vaccine, but also in so many other areas of our society where that divisiveness is still instilling hate. And there are groups and organizations in our country who are thriving on that hate to try to put themselves back in power, to continue to destroy our democracy and destroy our truth and destroy our economy and destroy society, not just in the United States, but around the world with that hateful rhetoric. And it's only for the people who are brave enough to stand up to that and to tell the truth that we're getting that other side. I've worked with a lot of journalists in the last few years. I've really had a crash course on media.
Without the media training.
Without the media. I had the media training, but this was the media training. And
yeah,
it still
by fire.
surprises me, though, Roberta, the number of media outlets who I've spoken to, so direct experiences, isn't hearsay, that are not interested in the truth. They want to dig up the drama, they want to dig up a story, and the truth isn't sexy enough sometimes to make their headline. The truth isn't sexy enough to put you on the screenshot. They want something negative. And a number of reporters, a number of media outlets who really told me, when I told them the truth, well, you know, we're not going to go there, we're not going to cover that. If you would give us something more, you know, dramatic or something. But the truth really wasn't that dramatic. Truth isn't as dramatic as a lie or a story sometimes. But the truth is what, in this case, would save your life.
Time is relative, as Einstein would say, and this has flown by, and we just have a couple of minutes. And so I'd like to fast forward to now. Where are we with the pandemic, and where do you want to go in terms of protecting the public?
Yes. Well, I have to tell you very clearly, and everyone listening, the pandemic is not over. We still have over 400 people every single day dying in our country and people dying around the world. We've made a lot of progress in making vaccines and drugs and diagnostics, tests, and we know a lot about how to protect ourselves with masks and social distancing and other non-clinical medical countermeasures, we call them. But to the best extent possible, people need to keep doing those things that are going to protect them. We are seeing new variants of this virus emerge. Today. And these new variants have an ability to evade or escape from all the immunity that we have, been exposed to, or through the vaccines or through even prior infection.
So what's your public health guidance for us today?
Sleep with one eye open, maybe, because it's not over. And as badly as we want it to be over, as badly as we want to just run out in the streets and go to parties and travel and hug everyone, you don't have to lock yourself down. You don't have to isolate yourself from society. But you should get vaccinated. And I'm so glad we had this new updated bivalent vaccine that has a component of it for the Omicron variant that is most prevalent today. And our vaccines are most powerful when they match the virus or bug that you're trying to protect yourself against. So I would encourage everyone to get the booster shot for this Omicron, this new bivalent vaccine. I would encourage everyone to test themselves still. Get tested. If you're going to be traveling, and be around other people, if you're going to be around vulnerable people.
You just came in from Ireland. How many people were wearing masks on the plane? What's the percentage?
1% at most.
1%?
I mean, seriously, I was in some really large airports. And honestly, this is an example where we are in society today. I snapped a picture of myself in the Heathrow airport as I was traveling. I had a 5-hour, 6-hour layover in Heathrow airport. And I put in my tweet, I'm that guy in the airport with a mask on.
Wow.
And
yeah,
all of the thousands of people I passed that didn't wear the mask. And in the UK right now, there's this surge of new variants, this new variant that's coming around, and we're highly vulnerable to it. And the masks do a great job at protecting you, but also if you are infected, protecting someone else. So when you wear a mask, it shows you care about other people. You're not exposing them to this virus if you happen to be contagious and don't even know it.
Right.
Because your tests give you a snapshot of time. And so the hate mail I got from posting that picture of me masked in the airport. So it was probably the most viewed thing I've ever had on Twitter, and over 1 million impressions on this. And the messages or the responses to it, thousands. And I would say probably are split 50-50 from the number of people who are saying thank you for telling the truth and thank you for protecting me and my family, and I'm still wearing my mask too, and I'm still doing everything because this pandemic's not over. That's about half, and the other half are the ones calling me an idiot and every name in the book and saying how ignorant I am and other public health officials, etc. So we're still not there, but the pandemic's not over, Roberta. Wear your mask, get the vaccine booster, and test before you go around vulnerable people, because you can save their life by not infecting them.
One last thing, and that is, how hopeful are you on your next trajectory in terms of protecting the public, the world?
Well, and news is already out that I'm leaving the Rockefeller Foundation, and I think it's been a great opportunity to work with the Rockefeller Foundation, who has done a lot of great work in responding to the pandemic. They've done a lot of great things in public health through the years. They're known for that, in fact.
But what's next for you?
Next for me is to continue everything I can do to strengthen our systems that are in place, to raise awareness of the gaps that we have globally about being able to strengthen surveillance, and to know and be able to detect something new that's emerging, to be able to identify the gaps in our public health systems in the United States and around the world, so we know where we need to strengthen our public health systems. So we have the workforce, we have the tools and the procedures in place to be able to weather another outbreak like what we've seen over the last few years, and to be able to really work on equity and access, because once again we saw in this pandemic the wealthiest people in the wealthiest nations got the tools, got the access, and we still have parts of the world who haven't received the vaccines and they don't have the access to the drugs and diagnostics. So if I can do anything to empower and strengthen that message, to bring equity and access to the world, make sure we have resilient and strong healthcare systems, make sure we have the financial resources from Congress and other public and private resources to make sure all the efforts that we've invested in for the last 3 years aren't washed out to sea when we do get this pandemic behind us, but they are a stepping stone for the future for a stronger, resilient, healthier community around the world. That's what I'm going to do.
Thank you for being you, Dr. Rick Bright. It's just been a pleasure. I'm inspired by you and to all the whistleblowers that we got to spend time with today. Thank you for your courage, for standing up to power with truth.
Thank you. It's a real honor.
It's my honor. Thank you.
Thank you.